Hello everyone, I'm Eric Cruz and I'll be presenting the dengue fever. So it was on 1635 that a first suspected dengue-like epidemic occurred. However, it was on 1780 that dengue fever was clearly defined by Benjamin Rush. 1828 was when an epidemic in Cuba it was first called dengue, then later on changed to dengue. Sporadic outbreaks occurred in New Orleans in 1873 that affected 40,000 people. 1879 to 1880 was when an epidemic occurred in the southern port cities in the United States. The vaccine was licensed in December 2015 in Mexico. So what is dengue fever? Dengue is an acute febrile disease caused by mosquito-borne virus consisting of 4 serotypes. All 4 serotypes emerged from sylvatic strains in the forest of Southeast Asia. Formal name is dengue fever. Common name is breakbone fever because of its intense bone and joint pain that accompanies the disease. 7-day fever because since the symptoms usually persist for around a 7-day period. Dengue fever. It was known amongst the West Indian black slaves as dengue fever in 1827. It's an arthropod-borne viral disease from the group 4 positive ssRNA. But it belongs to the group 4 Baltimore classification as a positive single-strand RNA. Family Flaviridae that includes Flavivirus, Pestivirus, and Hepativirus. The genus is Flavivirus. Species is dengue virus. 4 serotypes include DN1, DN2, DN3, and DN4. Note that getting one serotype and getting infected by one serotype does not mean that you're gonna get immunity against all of them. You just build up immunity against that one serotype that you're infected with. Some other characteristics of this dengue virus include single-stranded RNA that's packed in a viral capsid protein. It has 180 copies of 2 glycoproteins and complete virion, which is approximately 50 nanometers in diameter. It's also spherical in shape. On the picture, A represents the immature dengue particle, which has spikes that protrude from its surface over there, and B shows the mature dengue virus, which has a smooth surface and its membrane is enclosed by a protein shell. Here we have the dengue virus infection. Some people are asymptomatic, some symptomatic. 2/3 of the population are said to be infected by dengue fever, and some get the milder form, which is dengue fever, and the much more severe form of the dengue fever is the dengue hemorrhagic fever, which has thrombocytopenia, which is a deficiency of platelets in the blood and a vascular leakage. A much more severe case of the DHF is the DSS, which is the dengue shock syndrome, having an increased vascular permeability together with a myocardial dysfunction and dehydration contributes to the development of shock with resultant of multi-organ failure. Diagnosis can be through serology and identification of viral material in blood. Dengue viruses cause the most common arthropod-borne viral disease in man. Pathogenesis. Pathogenesis occurs first when a mosquito bites you, and then penetrates your epidermis through your dermis and secretes the dengue virus through its saliva that way, infecting the dendritic cells and macrophages by binding to its receptors, DC sign and mannose receptors. Some of these infected macrophage and DC cell go to the lymph node via lymphatic vessels, while others produce interferon that acts as a cytotoxic alarm that bring the natural killer cells and then the cytotoxic T cells to come out from the capillaries and produce an inflammatory response. The ones that go to the lymphatic vessels cause the dengue virus to be spread to the system in circulation. This causes viremia and plasma leakage, and eventually a much more severe form of the dengue fever, which is the dengue hemorrhagic fever. Life cycle first occurs when a virion binds to cell surface attachment molecules and receptors via endocytosis. Disassembly of virion and release of viral RNA into the cytoplasm occurs next. Then viral RNA is translated into a polyprotein. Viral protein replicates the genome RNA, and virus assembly occurs at the endoplasmic reticulum. Immature particles are transported through a secretory pathway when furin-mediated cleavage of PRM drives maturation of the virus. And then lastly, mature virus is then released from the cell. So transmission, we have perinatal transmission, which includes microtransfusion. That's when mucosal and blood contact from infected mother is passed down to the child, and breastfeeding via breast milk. Blood-borne transfusion include blood transfusions or organ transplants, where you get infected tissues from infected individuals. Here we have vectors, which are primarily the Aedes mosquitoes, mainly the Aedes aegypti, because it is less susceptible to the infection of DNV compared to Aedes albopictus, and will therefore require higher viral load in human host to infect the mosquito. So once the mosquito has taken its blood meal from this infected human, it will therefore take in the dengue virus, and will live with it until the rest of its life for like 2 to 4 weeks, and then bites a different healthy individual and passes down that dengue virus to them. So dengue fever and dengue hemorrhagic fever symptoms are almost indistinguishable, but DHF is associated with hemorrhagic manifestation, plasma leakage, because of its increased permeability. Principal symptoms of dengue are high fever, or at least two of the following, severe headache, pain in the eyes, joint pains, muscle pains, rash, mild bleeding, and low white cell count. You need to watch for warning signs after fever has declined, temperature has declined, 3 to 5 days after symptoms start. Presence of one or more of these warning signs indicate that you should seek medical evaluation. Warning signs include abdominal pain, persistent vomiting, red spots, bleeding from nose and gums, vomiting, black tarry stools, drowsiness, irritability, a clammy skin, pale or cold, and difficulty in breathing. Dengue fever or dengue virus itself doesn't really have a cure, so you have to prevent them at most. What is the first dengue vaccine made, and was made by Sanofi Pasteur, licensed in December 2015 in Mexico. The vaccine is used in endemic areas. Vaccine shown in clinical trial to be effective for seropositive individuals. These are individuals that have gotten infected by any of the 4 serotypes of the dengue virus. While for seronegative individuals, it has been seen to increase the risk of severe dengue if they were to get a natural infection after the vaccination. That's why pre-vaccination screening is required. Mosquito repellents are also highly suggested, especially those that contain DET, oil of lemon, eucalyptus, and picaridin, IR 3535. Spatial repellents also include mosquito coils. You can also wear long sleeves and long pants in order to prevent mosquito bites. Freestanding water must be prevented. Any artificial containers, barrels, plastic jars, pots should be the water should be thrown away so as to prevent mosquitoes from laying eggs into them. Female mosquitoes require water for breeding. Here are some dengue risk places. We have Mexico, Brazil, Ecuador, and majority of this over here. We also have Kenya, Tanzania, Yemen, and Southeast Asia. Here, this one's a much more current view of the dengue virus, its spread. I think this one's 3 month, 3 months. This was taken 3 months ago. As you can see, it's much more concentrated at the equator, since those are the tropical and subtropical areas where the Aedes mosquito usually thrive in. 50 to 100 million get infected each year. That's how infectious dengue virus is. And 500 of those do develop dengue hemorrhagic fever, which require hospitalization. And furthermore, once that DHF goes becomes more severe, the development of DSS, which is very fatal, increases in death. Instead of having 1 or 2% of fatality, if there's no proper treatment, it will increase up to 20% fatality. So 20% of deaths occur each year because of the dengue virus. There's no treatment for the dengue virus. That includes the dengue fever, DHF, and DSS. So also you need to go to the hospital if you think that you have the dengue fever, just to make sure. Stay hydrated, avoid aspirins or anti-inflammatory drugs, which are anticoagulants, because you'd want your blood to coagulate and not leak out. Fever, to lower down, you can drink acetaminophen or have tepid sponge baths or lukewarm sponge baths to lower down your fever. Like I said, I have to stress this out. You have to go to the hospital because there's no treatment. However, it's best to have proper medical attention, and I'm pretty sure doctors and nurses are way better treatment than you do. And that's it. I hope you have a good day and bye. Enjoy.